knowledge like common, right?
Yeah, it's very hard.
Yeah, it's stuff that you just don't know until you get in the class, right?
Yeah.
Okay.
And we all
So this,
hear about peds. Everybody.
no
Okay.
way! Oh my god, I'm so embarrassed. Why? What do they hear?
They hear
Help me
peds.
make it better. Maybe I can make it better.
No, it's not nothing bad. It's just that peds is very, very hard. Like that class is just like if you don't focus on it, they give us a fear warning. That's it.
Really?
They say it's very hard, so don't. They say how the health one is important, but with P, don't. They don't like listen, don't. So I'm like,
Don't sleep
okay,
on it either.
yeah.
Yeah, don't sleep on peas.
Alright.
So you got a total of 14 incorrect, and those are, we go over the incorrect ones. So the first one was this INO. Let's see how. So you got 27. So if you look down there, can you see it
Yeah.
well? Okay. I'm going to grab my coffee while you look at that. I'm not sure how you got 727, but you missed quite a few numbers in the calculation process. So
Wow.
you had to do the fluids, the flush, another flush, the normal saline. So that was your total for the day, your 12-hour shift. I wonder what 727.
Maybe I pressed something wrong on the calculator, cause this is a brand new calculator, and
Uh-huh.
I don't really get used to it as yet.
So let me see something. So the formula was 48 an hour. Where's the fluids? 2 flushes. Yeah. Well, this comes out to 60 mLs an hour. So I don't know what you were calculating here. Like if you divided 727 by 12.
So I was supposed to divide.
No, you're supposed to just add up. So if we start from the top, add up the feeding, which is 48 mLs an hour, times 12, obviously. And then a flush every 8 hours. So your day shift. So you would have 2 flushes. So that's 100 and 100. And the normal saline. Oh, here. The normal saline is 75 mLs an hour continuous. So that's 75 times 12.
Oh.
And there'll be similar stuff on exam too. So just take your time with these. Make sure, check everything off. Like, okay, I got the flush. I got this. I got the medication. Even sometimes a lot of students forget when you say you were going to give Zosyn, and
Yeah.
that's like a 50 ml bag. You have to remember that counts as intake.
And the ice, professor. So when it's ice, is you divide it by two, whatever it is.
Oh,
Cause what?
ice. Yeah, that's the ice. Yeah, that's
Okay.
the only one.
Okay.
Mm-hmm.
All right. Then. Are we gonna get any weight like convert temperature Celsius Fahrenheit?
No, I don't have that.
Okay. All right.
Yeah, I don't know. I don't know if I see the benefit in that.
Okay.
Because everything you can do on your phone when you're a nurse on the floor.
Okay.
Okay, so this one is, oh, here we go. This is another INO. So you got 320, but it was 772. Oh, this is what you were asking about. So 512 were the IV fluids, 90 for the ice pops because you're going to do the whole thing, 120 for the apple juice, and 50 for the Zosyn. I guess in my head I was thinking about this question.
Mm.
So 320. I don't know where you got 320. Let's see. 64 an hour times 8, maybe? No,
I
that's
think I
512.
was running out on time, so I just like put something for this one because I was going out on time when I was like, so
Okay. And then here's another one. Oh, this is another I know. So the catheter room's obstructed, so you have to flush with 10 every 4 hours, 3 times. So your answer would be 54. Because if they urinated 84, but you put 30 in, you can't count that 30. So it'd
oh,
be 84 minus the 30 you put in would be 54.
instead I had I think I had it. Mm,
Yeah.
yeah,
174? I'm not sure where that came from.
I had it was supposed to take away, but I had, but yeah, yeah.
And then this is for, taking care of a syncopal patient. Which one would be the best? Now, you know how in nursing, we like all of them are usually correct, but one is the best. So that's kind of like how this is. So the best for the 6-month-old would be this syringe here, because that one they could spill. It's like a spoon, a cup they could spill, and a spoon they could spill. But this
Uh,
one is, we can just squeeze it right in their mouth.
I was thinking because they say no straw whenever they have like, and I'm like that looked like a straw, so I was like no.
Oh, yeah,
It
no,
kind of like
this
looked
is,
like a straw when I was reading. They say whenever they have anything distraught or don't put no straw, or so that's what I was going off for. But yeah, I get this one.
oh, yeah. That's another thing that nursing students do. Sometimes they add in extra scenarios that aren't there. So try not to do that.
Okay,
Because nothing here says that they had a surgery where they can't have a straw.
okay, all right.
Yeah. And then this one is dosage.
So I get all
See, these are
doses
little.
incorrect.
No, because the eyes and nose are not considered dosage. So, but kind of, I guess, yeah.
Oh my God, Professor, you show a lot of those.
Yeah, this is, this eyes and nose are just considered content. They're only 3 points. They're not dosage.
Okay.
So ED, bacterial meningitis, ceftriaxone, 100 milligrams IV times 1. And then, so they already got the 100 IV. And then you're going to do 80 milligrams per kilogram per day,
Yeah.
Q12 hours. So 80 times, what was their weight? 4.6. So 368. But you have to divide it in 2 because it's 2 doses. So 184.
Mm.
I don't know where 31 came from.
I need to go work on my dosage.
Yeah. Yeah. Or peds. And then this one was the CJ sim. So this one, if you did the CJ sim, you'll remember he had epiglottitis.
Yeah.
And so the things that you were supposed to pick up on with epiglottitis, they have to remain NPO and nothing by mouth at all. So the question states, the patient is being, so I give the diagnosis because I don't think the students should have to guess what the diagnosis is most of the time. So I give you the diagnosis, then it's your job to know what to do or not do. So he has suspected epiglottitis. Which one would you question? So the orders that you would question are A, F, G, and H. All the other ones are good. We like those orders.
Okay.
We're not going to give him anything by mouth. Let me move it up a bit. Okay. So you could read it.
I know that they say nasal. nasal flaring is like a big thing. It's supposed to like with infant, so you have to watch out for it. So that's what I was thinking, because I know when
Yeah.
they
So A would be considered a distractor, because here you're supposed to pick up that B, they're already in respiratory failure. So in A, they're in respiratory distress. Yes, we want to get them while they're still in distress. We don't want them to keep going into respiratory failure. So if this was not here, this 22,
yeah,
yes, you would, the B, I'm sorry, you would pick A.
okay,
But because this B is here, they're in respiratory failure, you have to see that patient first.
okay.
That is so low, 22 for a 4-month-old.
It's supposed to be 30 to 60.
Yeah.
Yeah, I should have picked that one up.
Oh, this one was from the crossword puzzle. Did you study the crossword puzzle?
I did go over it, but um, they set up. What age do they set up? They set up at
6 months. Yeah, 6 months. And 9 months they used the pincher. You got C right, so you should have got partial credit. Yep.
I got it's 0, professor.
No, you
Oh,
got
75.
0.75.
Oh,
Yeah.
75. Okay.
And then this one is 6 liters. Oh yeah, in the chart in your book.
Yeah. Yeah, I went over this one, professor. I went over and look at all of them and see which one is the most, and I see the percentage.
Yeah. Well, that's that one. And this one is 6-month-old child. Development is slow. What assessment finding supports the parent's concern? So he's 6 months and he cannot. Oh yeah. See, B, they've got to be at least 12 months usually for that. But by 6 months, they should really be rolling at 3 to 4 months on their back, like rolling over.
Oh, okay.
So that's why that would be concerning.
Okay.
This one, adolescent female, laparoscopic surgery. Oh, question the nurse. You know what it is with adolescents? They don't want to hear anything adults have to say. So we probably want to ask, like, draw it out of them what concerns that they have.
So we have to like pull it, like how we do that?
Like, so when you're thinking about your therapeutic communication, you're asking things like, tell me more, right? You remember that from mental health? Like,
Yeah.
tell me more, or what concerns do you have, or, things like that. An adolescent, yeah, they're not going to want to talk to an adult. They might want to talk to another kid. So if that had said, talk to another kid who had the surgery,
Yeah.
that might have been a better choice.
Okay.
Yeah.
I was stuck between the two. But I was saying, since us is the brother and his family and don't break up family, that's what I was thinking. But I was stuck between the two. I wasn't sure.
Yeah. So see, we want him to get out there and start achieving things on his own, so that he can start feeling confident and building self-esteem.
Okay, I was like put him with his brother. Yeah. Okay.
That's a good second choice. Oh, this was like a drop-down question?
Yeah. Is there any more drop down coming?
I think. Did you get my email?
I did, but
Study guide?
I didn't really looked it over or start studying because I'm trying to finish up something else before I go on that.
There's 2 drop-downs in the next test.
Okay.
I put the blueprint in the email.
Oh, okay. Thank you, Professor.
Oh, you're welcome. I feel like it makes the students feel more comfortable if they have a blueprint.
Yeah. Oh, compare with anxieties, end of semester, you know. So every little help, even little help.
Yeah, yeah. And we want to keep you at that 80 and above.
Yeah, most
So
definitely.
yeah, this one, the correct answer was respiratory failure, and then check the pulse ox.
Okay.
And then this one is, oh, this was a select all that apply.
So I just missed one.
Yeah, so you got 2 out of, no, did you get them all right?
No, I just missed
Oh,
B.
you missed one. I see that. Yeah,
Uh,
so not bad.
so Professor, for the finals, I know it's coming into a end. For the finals, are we gonna repeat any question?
I really can't say that, but it is cumulative, and there's not going to be any new material.
Oh, okay. All right. Very good. Is there anything else? Oh, what about the professor feedback? Is that time passed already?
You know, I have not gotten any emails because we normally get the emails and they're like, remind your students, remind your students, remind your students. And I haven't gotten any emails on the SFIs. You
Wow.
haven't gotten one either?
No. I don't know
I'm
if
going to
they
have to.
send it, but I don't normally check. But I don't know.
Well, I didn't get anything. And you're right. So I might have to check with the IT guy because I did not get any SFI requests. Yeah.
Okay. Okay, Professor.
Yeah.
All right.
Good
Thank you
stuff.
so much,
Any
Professor.
questions on the for exam 2 that you're learning and you kind of like?
Um. No, I'm just going over leukemia.
Mhm.
Is anything gonna be a leukemia on it?
Yeah, we do have leukemia on there,
Yeah. So that's where I'm. I don't know if I
but you
have
have
enough.
to know what it is, right? I always want you to know what it is. What's happening? Why is that? What is going on that's happening, right? So the abnormal white blood cells are being replaced in the bone marrow with the normal blood cells are being replaced with abnormal blood cells in the bone marrow. So that's telling you what's going on. What is it? And then what is it going to look like when someone has um, low white blood cells because there's too many abnormal ones and then there's not enough normal ones, right? So they are at risk for infection big time, right?
Yeah.
Yeah. So how are we going to treat them then?
A
So how are you
private
going to care
room.
for them as a nurse if they're high risk for infection?
Private room.
You're probably, yeah, you're going to put them in a private room probably. You might wear a mask. You might put a mask on them when they go out of the room. Think about things like
Visitors.
um, what?
Visitors, plants,
Yeah, like
food.
no fresh flowers, like things like that. So go over in that section and in the nursing analysis, read over how to care for those patients.
One question, Professor, before you go. So they are allowed to eat fruit, but they have to peel it first. That's the only thing, right? Or they can't have fruits. Cause
I
I'm,
think it's in your book under the nursing analysis,
yeah.
and so read that section about the nutrition for sure, because that's going to be your part. What if you saw a family member coming in with a big basket of flowers and fruit and stuff like that? So read what it says verbiage exactly in that
Okay.
section in your textbook.
Okay, Professor, say less. I will.
Yeah.
All right. Thank you so much, Professor. I do enjoy the rest of your day.
Oh, no, you
Thank
too.
you for being
Bye-bye.
punctual.
Oh, what's that?
Thank you for being punctual
Oh,
on time.
bye.
All right, bye, Professor.